It's sad but true that our cats don't live forever. As a caring pet owner, it's crucial to pay attention to signs that show the end might be near. This will help you give your pet the right care to keep them comfortable during this tough time. Sometimes, noticing these signs early can even help you identify a problem and extend your cat's life a bit more. If you love your cat, please watch this video to learn about 11 important signs that suggest your cat might be close to the end. And stay tuned to hear some helpful advice on saying goodbye to your beloved pet. Extreme weight loss. Senior cats often experience weight loss, and some of it is completely normal due to the natural decline in muscle mass as they age. As your cat gets older, her body becomes less efficient at digesting and building protein, leading to a loss of muscle mass. Even if your cat is eating well, she may still lose weight. As time goes on, this weight loss can become more noticeable. In some cases, old or sick cats may become extremely thin, with their ribs, spine, and hip bones sticking out under their skin. Extreme weight loss, known as wasting syndrome, can be caused by cancer. In this situation, the rapidly dividing cancer cells demand so much energy that the body breaks down its fat stores and muscle for fuel. Conditions like hyperthyroidism and chronic kidney disease are also common culprits for weight loss in senior cats. Loss of appetite. It's common for cats to lose their appetite during prolonged illness or due to dietary allergies. When a cat shows disinterest in food, it doesn't automatically mean they're dying. Instead, it's a signal that they need assistance. Before jumping to conclusions, it's important to investigate and address any underlying and treatable health issues. However, in the final stages of life, almost all cats will stop eating and drinking. This leads to visible signs of wasting away, as the cat lacks proper nutrition. Dehydration becomes apparent, noticeable through less skin elasticity, sunken eyes, and darker, reduced urine output. Not drinking. Sick cats often lose interest in drinking, which can lead to dehydration. If your cat is still eating, you can boost her liquid intake by offering canned food or adding water to her meals. Sometimes, you may be able to provide water using an oral syringe or squirt bottle, but it's important to do this cautiously. Point your cat's muzzle downward and administer only a small amount of water at a time. Forcing too much water at once can lead to it going down her windpipe and into her lungs, potentially causing choking and aspiration pneumonia. Low respiration. A healthy cat usually takes around 20 to 30 breaths per minute. When the heart weakens, it can't efficiently pump air into the lungs, reducing the amount of oxygen in the bloodstream. At first, your cat may breathe rapidly and struggle to breathe, but as organ failure progresses, breathing becomes weaker and slower. Towards the end, breaths become less frequent until your cat becomes too weak to continue, eventually stopping breathing altogether. In some cases, you might observe agonal breathing, which appears as sudden spasms as your cat nears the end. During agonal breathing, the heart has often already stopped, and your pet is no longer conscious. Lower body temperature. A normal temperature for a healthy cat ranges from 37 to 38 degrees Celsius. When a cat is nearing the end of its life, one sign is a drop in body temperature. As the heart weakens and other organs begin to shut down, the body temperature may fall below 37 degrees. To check your cat's temperature, you can use an ear or a digital rectal thermometer. Additionally, feeling their paws can give you an indication. If their paws feel cool to the touch, it might be a sign that their heart is slowing down. Behavioral changes. When a cat is approaching the end of its life, you might notice various behavioral changes. The specific changes can differ from one cat to another, but what's important is recognizing that there has been a shift in their behavior. Some cats become more withdrawn, possibly cranky and irritable, which could be linked to pain or cognitive dysfunction. On the other hand, some cats become extra friendly and clingy, seeking constant closeness to you. Cognitive dysfunction, similar to dementia in humans, is also possible. Cats experiencing this may wander the house at night, become more vocal than usual, and display signs of confusion, even in familiar surroundings. Other changes can include your cat disappearing for extended periods, skipping meals, or developing altered sleeping patterns. Decreased mobility. As cats get older, they may struggle to move around because their muscles weaken and they feel pain from things like arthritis. It starts with small challenges, like not being able to jump onto surfaces, and can progress to bigger issues, like struggling with stairs or a tall litter box. To assist your cat, ensure that her necessities are within easy reach. Use ramps or steps so she can safely reach her favorite spots. If arthritis is causing discomfort, the vet can provide cat-friendly pain medications to make her more comfortable. Sleeping more than usual. When cats are nearing the end of their lives, they often become less energetic and tend to sleep more than usual. They may withdraw from interacting with people and other animals, and they might not show interest in eating or drinking. Considering that cats naturally sleep a lot, it's important to be cautious when comparing your cat's current sleeping habits with those from before. To get a clearer sense, you can also look at other signs on this video. This can either strengthen or weaken your intuition about your cat's well-being. Abnormal odor. As your cat gets closer to the end of her life, she might start to have a strange smell on her body. This happens because tissues break down and toxins build up in her body. The specific odor can differ based on the particular health issue. For instance, cats with diabetic ketoacidosis may have a sweet and unpleasant smell, while those in kidney failure might have breath that smells like ammonia. Less energy. As the end approaches, your cat may have a lot less energy for their usual activities. They might seem less lively, spend more time sleeping, and be more difficult to wake up for attention, grooming, or meals. While cats are known for sleeping a lot, if your older cat is noticeably sluggish and sleeping even more than usual, this change could be a significant sign to pay attention to. They want to be alone. Cats often seek out a quiet and isolated spot when they are very sick. This behavior stems from their instincts in the wild, where finding a secluded place helped them stay safe from predators. If your typically friendly cat suddenly prefers to be alone and shows no interest in being around you, it could indicate that they are getting ready for the end of their life. How to comfort a dying cat. If you think your cat is nearing the end of her life, you'll want to ensure she feels comfortable and loved during these final days. Here are some suggestions for comforting a cat that is about to pass away. Offer special treats. If your cat still has an appetite during her last days, try offering tasty foods to make her more comfortable. Strong-smelling options like fish-flavored food can be tempting for your cat. If chewing is a challenge, consider offering canned food mixed with warm water. Or you can try giving her some baby food. Take them for a checkup. Bring your cat to the vet for a checkup. While there's no cure for aging, there could be other issues at play. A vet can identify any health conditions and determine if they can be treated. Visiting the vet is also an opportunity to get expert advice on how to keep your cat comfortable during their final days. Provide them a soft and comfortable bed. Make your cat's sleeping area cozier by adding some special touches. Place extra blankets for added comfort, and make sure to change them regularly, especially if your cat is having difficulty reaching the litter box. You can also put a small heating pad or electric blanket at the bottom of the bed to keep your cat warm. Just remember to layer extra blankets on top to prevent the heating pad from making your cat too warm. Put your cat's things nearby. If your cat can still move around, make things easier in the final days by placing the food bowl, water bowl, and litter box close to your cat's bed. This minimizes the effort your cat has to exert throughout the day and helps keep them more comfortable. Consider medication. If your cat is unwell and experiencing noticeable pain, discuss with your veterinarian about obtaining a prescription for painkillers. You can mix the medication with your cat's food or administer it by hand or with a special pilling tool. Pain medication can greatly enhance your cat's comfort and well-being during those final days. Feeling sadness after losing your cat is completely normal. No other pet can replace your cat, but each one brings unique qualities to our lives, making them special in their own way. Take a look at old photos and videos to reminisce about your cat at her best, and think about ways you can honor and cherish her memory.